Here we go. All right, my name's Larry. I'm with On Point Movement and Performance, and just wanted to do another spotlight series with my friend Elizabeth.
Good to be here.
Yeah, who I've known for a long time, or 15 years or so.
Just about.
Yeah, 15 years or so. We met at church years ago at Watermark Community Church. But yeah, just wanted to spotlight her counseling. One of the reasons I wanted to do this, because it's a lot of times a conversation I have with a lot of my patients, stress can cause pain. And so if you don't mind, I want to share a quick story.
Yes.
I had a patient that she came in for shoulder pain, and we went through her movement analysis, which this is a piece of it here. We do a little bit more there as well. But she didn't have a whole lot of movement dysfunction.
Yeah.
And I was like, hey, that's when I was like, I need to dig deeper, right? Yeah. We did some strength testing, and she did have some strength deficits. But then I asked her, which from my mentorship that I did with Active Life, which is funny that's in the background here, they have this concept about load versus capacity. And one of the things they talked about is SDS can affect pain: sleep, diet, stress. Mm-hmm. And she said she was sleeping well. She actually ran a exercise company. I think she did Jazzercise, which I didn't know was still around.
Yeah.
She has 2 of those practice or gyms. And she... and I asked her in stress. So I asked her, I was like, is there any stress in your life? And she was like, well, I'm running 2 companies. I'm working full time. And I just went through a divorce. And I have 3 teenage boys.
Yeah.
That's a lot of stress.
Yeah.
And so her traps are just overactive and hurting her shoulder.
Yeah.
And the funny thing was, I was like, hey, I'm not a counselor. Mm-hmm. The way I deal with stress is prayer, meditation, deep breathing. Why don't you find some things to do, find some time to do? Within 2 weeks, pain was gone.
That's amazing.
And she also did some counseling too after that, but just reducing her stress and learning how to process it. And so that's why I wanted to talk to you.
Yeah.
I was like, man, counseling can help reduce your stress or help you cope
more effectively.
Maybe we can't change our stress, right? But we can use tools that maybe you teach your clients to cope with and deal with stress.
Yeah.
So that's why I gotta...
thank you for the invitation. And I love that, because we have to look at the person holistically, the whole person.
Yeah.
And I love that your approach is to treat the whole person.
Correct.
And that's where people really start to see the gains and the improvement.
Yeah.
And so when we hold stress, sometimes we're not aware of that it has its roots back in the way we coped in our childhood.
Correct.
And then the adult stressors then compound on that.
Yep.
And if that's already the area that we're used to kind of bracing, then it's very easy that those areas are going to get activated when we're stressed and cause physical pain, even though diagnostically we're not seeing something that would show an injury.
An MRI won't show you, hey, stress is causing your pain, right? It's something we have to dig into and ask questions, right?
Yeah.
So Elizabeth is a LPC, right?
Yes, that's correct.
Right, licensed professional counselor. She is based here in Dallas, right? Whereabouts are you?
So my physical office is in Allen.
Okay,
and
Allen, Texas.
We are right by Waters Creek Shopping Center.
Oh, yeah. It's a lovely area.
It is, and we have a walking trail that just goes right out the back door. So we even offer walk and talk therapy as a way to move and reduce stress and anxiety.
Physical,
yes.
Right? Physical. Right?
And be out in nature and introduce some of those strategies practically in the session. And then we offer virtual counseling throughout the state of Texas.
Okay, awesome. So my first question for you, which I got here, is just what made you decide to be an LPC?
Really started with my own journey of being a young adult and moving away from family for the first time and going, oh, this is a big change. And I started going to see a therapist and I discovered things about myself I didn't know. And I found I really loved putting the pieces together of learning about myself. And I said, oh, if this really excites me and I'm seeing the benefits of my life, I wonder if
I remember you walking through that journey.
Yeah.
I remember that.
I think it was around that time when
we met.
And just going, what does that look like?
Yeah.
And began pursuing my master's in counseling. And that was a much longer journey, but you learn through that process.
Yeah.
And I think to this day, it's one of the things that, like, going to work is not hard.
Yeah.
Because I'm doing something I was created for.
Yeah.
And I find a lot of joy in it.
Yeah.
And that's one of the common questions I get asked is, you know, you hear a bunch of hard stuff, like, I bet your job is so hard. And yes, there is an aspect of that that's very true. Like, I hear some heavy things.
Yeah.
But one of the things I think that sets me apart as a counselor in the way that I work is I am all about seeing people restore functioning in their life in all areas.
Yeah.
And stepping into the life that they were created for. And I think that's really exciting work.
Yeah, awesome. Yeah, I mean, I've done my share of counseling. You know, we both went to Watermark for a while. I still go there, but there was a program there called Regen I did, which was great.
Yeah.
But I also did counseling on top of that.
Yeah.
You know, because I had a lot of things that I needed to work through as well. And it was so beneficial. And, you know, I still use those tools today.
Yeah.
You know, and, you know, some of the stigma around medication and all that. I've been on medication. I'm off of medication, on medication. You know, there's been times in my life where I've had to be on and off. But at the root of it, counseling and, for me, prayer, meditating on some truths that I need to know about, you know, about myself or this world, you know? So you already shared what makes you different, basically. You answered my second question.
Yeah, you're welcome.
No problem. But yeah, can you expand on a little bit more about like what makes you different?
Yeah.
You know, what are some strategies that you do, or maybe some simple tools that maybe somebody can use in this podcast today, you know?
Yeah, I think one of the things that sets me apart is the belief that people can get better. And I think a lot of counselors hold to that, but I think not enough, I think, really get rooted in that the diagnoses that people often get labeled with are ways that we understand clusters of symptoms rather than seeing that as an identity and really operating from the place that
that's so interesting.
Change is possible. And if we think about neuroplasticity in the way that we can renew our mind around right thinking, and oftentimes the things that we see in our life are the outflow of wrong beliefs when we see repetitive patterns. And that's really what most people come into the office for is, I've hit a stuck point. That victim mentality, if things never work out for me.
Well, that diagnosis mentality.
Yeah.
Right? I'm
bipolar, and so because I'm bipolar, and so they feel like they're locked into this kind of up and down roller coaster, and that's how life is always going to be. And it doesn't have to be like that. Do you have to put in the work? Yes. But a lot of times those problems come from experiences we had when we were really little that lend to beliefs that we're not good enough, we're powerless, we're not wanted. And when we start to live out of those places, we have a hard time maintaining our boundaries. And so these become the setup for
people pleasing,
chronic overworking, people pleasing, chronic victimization, whether that looks like exploitation, which I particularly work with victims of trafficking. That's an area
I remember you used to participate in that ministry. What was it called?
So I started out with Poema, which is a local organization, while in grad school, and then moved into being a residential director, clinical director of a program for 4 years before launching my own practice. And now I serve survivors on an outpatient basis and serve different ministries and organizations that provide advocacy, and then they connect them with mental health services and help with covering the cost. And so I love that I can still do that. And then I see the whole scope of trauma, whether, you know, that's a young adult who's like, hey, I'm trying to figure out what it looks like to be successful. When we think about functioning, well, what are you believing about yourself? They may come in, I don't have a lot of trauma, But like I'm finding I isolate. I've
I don't
worried
like
about
to go into big crowds, or maybe I don't like to, whatever, because social aspect plays a big part.
struggling with stress at work, and so they come in. I'm getting stomach aches, showing up in their bodies.
Oh man, I had my dad passed away in March.
I'm so sorry.
And I was having some light GI issues just from work. Owning a business is a whole deal.
Yeah.
But man, when my dad passed away, my stomach started hurting so bad. And I went to the GI doctor, got an endoscopy, paid thousands of dollars. They found nothing.
Yeah.
They said, you have some heartburn.
Yeah.
And dealing with my stress helped a lot, processing it. Luckily, I have a lovely wife, Jen, if she's watching this.
She's amazing.
She helped me, my community group at church helped me. That's when I had to get back on some medication a little bit. I'm kind of coming out of that right now, and so I'm processing, should I just taper off the medication? I don't even think I took it this morning, because I'm finding that I'm not needing it anymore.
Yeah, and we all need different types of support in different seasons.
Yeah.
And I love that you shared about how it started showing up in your body. And that's really common that people experience that type of response. So we've got the vagus nerve, which runs from the base of our brainstem.
Regulates a lot of autonomic stuff.
Functions.
Blood pressure.
Yes.
I know.
And so we want to be in our ventral vagus state, which is a connected, grounded state. But life happens, and it can send us out of that state, which we know as fight or flight or freeze. And so fight or flight is our sympathetic nervous system. And that is going to be held with a lot of that tension and bracing through our spine. So that's when I might
That's when you send them to me and say, hey,
can you evaluate?
Counseling's going to help you get through some of this pain, but some physical
can we
therapy,
roll it out?
Physical therapy could help too.
Yeah. How do we work hand in hand?
Yeah, exactly.
Because sometimes we need to get that joint moving, and in the working with a physical therapist, that actually allows some of that held stress to be released.
Exactly.
As they're learning stretches that they can learn to breathe into.
Yep.
While then connecting of like, what is my shoulder trying to tell me that, and now I'm finding words for, and putting the pieces together. So that way I've got some tools of what is it that I'm not wanting to be able to acknowledge, can't put words to, that then is showing up as pain, saying something's not okay. This is what we do in my office is okay, so let's get curious. And I think that's one of those things that sets me apart is the integration of EMDR and IFS.
Oh, you do EMDR? I've heard a lot about that. I've had some friends do that. I've never done it, but I've heard of it.
And what I love about EMDR.
What is it? Say what.
EMDR is eye movement desensitization and reprocessing. Which is a long title for really we're working with bilateral stimulation to the brain, because we know that when people experience trauma, now trauma can be like our big T, like really horrific events, shocking events that are overwhelming. They can also be small and chronic, and that over time can build up, like bullying or a critical parent. A lot of times people come into my office and they're like, I didn't have any trauma. And then we start to drill down. They're like, oh, but my parent would give me this look. And not that their parents were bad or
burst of anger occasionally that
would have an impact. And so that's where the body starts to store those things. And then what we do with EMDR is help the body get unstuck. Through helping to be able to process and go, oh, I'm holding on to a faulty belief. Maybe it's my fault. And now through that work, we can help them put the pieces together and come into thinking brain, go, oh, at 5, my perception of that was based off of, what I cognitively understood as a 5-year-old. And now I'm able to get, oh, it wasn't my fault. And now the release that happens, the body is able to release some of that held tension. And it's not uncommon because also we've got our parasympathetic that then holds in the gut, in the diaphragm. So I've had clients, we've had shoulders that have released and they're like, oh, the tension's gone. People have burped and all of a sudden they're like,
I was having
whoa.
indigestion. It's pretty much gone now.
And it was all because of this stored emotion that hadn't been metabolized. And so I really believe in the integrative work that allows us to be more effective in the healing journey when we're integrating PT
and diet. Work with your doctor.
Yes.
Yeah.
And a lot of times they'll come in. I said, hey, I'm not a physician or I'm not a PT. Let's get that ruled out.
Yeah.
Because sometimes there is overlap, and I want to make sure we're covering all the bases.
Yeah. We refer out to whatever professional we think they need. Hey, we think you need an MRI. Or hey, you need to deal with your stress. Now I have someone to refer to. Like I don't have an LPC that I regularly refer to, so that could be you. I didn't realize you were so close. So that could work for some of my clients.
So I think what type of client or what the work is someone who really wants to do that long-term work. Yes, I can work with people short-term. But the EMDR IFS process really is about first safety and stabilization. And that's going to look different for each person. But we're going, how are you functioning? Right? And that is looking at how are you managing your emotions? How are you managing your safety? Managing your environment? And we're going to start there as a base.
Does that help addiction?
Yes.
Okay, I was just thinking of somebody.
Because a lot of times it's about addiction is not because people want to be addicts. But it's about escape, right? About
coping.
Not feeling the difficult emotions, and so that's why we start with like learning how to name and identify our emotions, how to ride the wave of emotions. Because a lot of us weren't taught those skills. And if all of a sudden I go, okay, let's talk about your trauma, and we don't have that foundation, that's not going to feel good. And it causes people to terminate therapy prematurely before they actually see all the depths of what it can do. And then we start to go, so how is it impacting my life now? How's that belief showing up in my job? Showing up in
my
marriage
or my
with
kids,
the kids.
Work,
limiting my goals.
And
that's where, we help people to start to shift their beliefs instead of, this place of being powerless to, no, I have voice and I have choice. And when we feel powerless, that's going to activate our nervous system. It's going to send us into fight or flight or shut down. And so when we teach people how to recognize that, wow, that really changes how you start to show up in your marriage, show up in your family system. And then you feel better about yourself. And then it opens the door to more changes. And it's been fun to watch the college student who comes in kind of insecure, kind of wanting to be hidden. And all of a sudden they're showing up and they, instead of baggy sweats, they've got their outfit together and they've styled their hair. Or
they're not wearing clothes that look like they're about to sleep.
Or they come in, they're like, hey, I took some risk at work and I asked for a raise or an opportunity, or I talked to someone new. And that's really powerful.
You're making me think of so many people right now. I have, the example you gave of a college kid. I think a lot of this generation is struggling with what do I want to do in life? And I'm not merciful sometimes, and I want to be you just need to work, find something to do. It doesn't matter. Go be a plumber. Go be an electrician. That's what I just want to do. But I think there's something deeper there. It's hey, what would you say to be the next step for maybe a college kid that doesn't know what they want to do in life? I'm sure that's a loaded question. But
I think that could hit at so many different points of life of people. Someone finds themselves after a divorce and they're like, who am I? And I think it comes down to that question of identity. What I'm hearing a lot from our Gen Z folks is, it's all on me. I've got to make it happen. Well, that's overwhelming. That's a lot of pressure.
It is.
And so when you start to be able to feel like I'm capable, I can know myself, I can know how I'm created. That's what I love about IFS. It's all about getting to know who we are authentically created to be. And in that, I think we get to start to see the strengths that we have. And we can accept also that we come with weaknesses, but that doesn't make us less.
Very good.
And then we can take risks. Then we're not afraid to try things.
Yeah, that's awesome. Let me see what I got here now.
Yeah.
I mean, you answered so much of this already, I feel like, naturally. You don't even have to ask you these questions. Man, yeah. Wow. Yeah, I feel like you answered that. Yeah, I love that analogy that you talked about the identity or diagnosis, the like, bipolar or schizophrenia, whatever it is, the diagnosis. I'm sure, I don't know much about mental diagnosis. I'm sure there's a whole list. But there's a whole list in the physical therapy world, right? And so like what I tell people too is that like, hey, your diagnosis is not always the reason for your pain.
Yeah.
And we do a movement dysfunction analysis here to figure out what the cause is. And I feel like that's what you're doing. You're kind of like, hey, yes, you have been diagnosed with bipolar, but that's not you, right? Let's figure out for us it's the movement dysfunction, but for you, you're digging in and figuring out like what's the, I don't know even what the word would be, like how the brain is working.
Yeah, like what was the setup that led to these vulnerabilities? And a lot of times with things like bipolar, right, there can be genetic components to it, like organic. Drug use can then have an impact, trauma, because it can create that dysregulation.
And if you have all those things, drug use, trauma, like
and
at a young
genetic
age,
vulnerabilities to it. But that doesn't mean you cannot, like you can't, like it's not a limiting factor to having change. Because I've walked with people who were told you will never be independent and able to function because of the type of trauma and mental health diagnoses that are now learning to thrive. And when I say learning to thrive is they are being able to step into goals and dreams that they had and be able to see substantial shifts happen in their life. Now, are they where they want to be yet? No.
Are we
but
ever?
We're all in a process. But for them to go, okay, instead of feeling stuck that there's this wall and I can never get over this wall, they're like, no, I'm actually living out and moving towards the life that I want. And I am not my diagnosis. And I have a life that I'm proud of. And
I'm not my addiction.
And to see that there is hope, that there is, like they can feel good about themselves. Which means then they have better boundaries and they get out of that place of being, bullied at work. That's a big one that people come in with.
Oh man, I
and the
experienced
stress.
Some of that. That's one of the reasons I remember I told you I had a management change where I was working, and which kind of led to me making the decision to start my own thing, and after I left, that management somehow disappeared after that a year ago, a year or two after I left, or I'm not going to get into it, but I made the right choice. So
And what people don't often realize is a lot of times those experiences it's not our fault when we get bullied, right? No one deserves to be bullied. I don't think people intentionally set out to have these patterns. No one wants that. But I think oftentimes we're like, well, you seem to be the common denominator. Or, a lot of people come in and they've experienced that chronic bullying at different places.
Intimidation.
And it's so common in the workplace these days.
And what if you're intimidated as a kid and then you're responding that way as an adult rather than, hey, like we're told to be bold and step up and challenge things, but your body and your brain automatically goes back to those patterns.
And that's why we have to use tools like EMDR and IFS to really help the body release those held reactions. So that way we can be present and be in our window of tolerance, meaning that ventral vagus state where we feel connected. And we can go, you know what? No, like that's not okay. And we can do that with respect. Respect to the other person and respect for ourselves. And then that starts to build that confidence. And that's where we can start to shift those patterns and we're not end up in the, like, I'm constantly running from relationships, running from jobs, running from
responsibilities.
My family, because this is the pattern over and over. And so that's one of the things that I love about integrating IFS is one of the core things is coming back into the C qualities, which is compassion, curiosity, calmness, clarity,
I feel calm
courage, and connection. And when we operate that way, we create safety in our environment. for people that we love, for our relationships, and in our work environments. And so that's why I've gotten really passionate about the work that I do, the impact it's had in my own life, in learning to do the work. And at first I thought IFS was just a bunch of
baloney,
woo-woo.
Yeah.
Like it's a little, it's, connect with this younger part of you. I'm like, But when I realized there was parts of me that were still holding on to sadness, to grief that I hadn't been able to look at. And I started to go, no one helped you to process this pain. And I was able to look at it. I felt a physical shift in my body. It was the weirdest thing. And I was like,
I will say you look the same, but you look different. I don't know if that makes sense.
Yes. and that's what I love getting they're like, why am I feeling my body? Like, feels like there's something in my throat, or I've got tension here. And then they come back and they're like, oh my gosh, I set boundaries. Like I did this. And
I'm comfortable with who I am.
I'm not as anxious. Or
Yeah.
they're like, I'm taking better care of myself.
Yeah.
And that's what I think, coming back to what makes me unique is really that functional piece is we got to start with how do we improve how people are functioning in their everyday life? Just like in PT, it's about improving and restoring functionality.
Yeah. It's not a quick fix sometimes.
No, slow is fast.
Yeah. I tell my patients all the time, it's like, hey, you will start noticing things in a few weeks. And then people will start noticing things in a few weeks. Or a few months. Because they'll say, hey, you're walking around better, or you're feeling better. Like I can tell. You know? It's the same thing with losing weight, right? Or working out. Like you can't go into the gym and work out 2 times and expect to be stronger. Right? But if you do it consistently and you're committed, you see the growth.
And being willing to, I'm sure there's PT exercises that are not the most comfortable at times, right? Because we're having to work on areas that have a limited range of motion. And so sometimes there's pain involved, and it doesn't feel good to look at difficult emotions. I don't like having to face things. But I know that as I have leaned in, when there's been points in my life in particular where I don't want to feel all this anxiety, but I made the choice to okay, I can either lean in or I can go back to old patterns. And when that has been the acceleration. And I learned things about myself that I didn't think were even in there, and you build your confidence. And so I think that's too, when you are willing to look at the hard things, and little by little, because there's parts of us that are going to be resistant, and so we're not going to violate those parts of us and say, no, look at it, that's not loving and kind. But when you say, I'm going to be with you, and we teach our clients how to be with those wounded parts.
Partner with them, right?
I see myself as a coach.
I do too. I always tell people, hey, you're not dependent on me. You got to do the work at home too.
Do your PT exercise.
Do their PT exercise at home. I had a question that popped up in my head. I'm trying to see if I can frame it, but it kind of goes back to that. What does it look like for them to do the homework outside?
That's a great question.
Do you give them papers, or hey, I want you to work on this thought this week? What does that look like?
So the way that I work is we're starting on nervous system regulation, because we talked about earlier, if I'm dysregulated, I'm not going to stand up for myself. I'm going to go back into the old pattern of intimidation that happened when if my dad got really big and so I shut down, and my boss gets really big. But if I can take a couple of breaths, recognize, oh, that's that familiar feeling, and then I can respond with confidence, calmly. So we start with recognizing where is those triggers showing up in my everyday life. And then we practice breaking that apart so we can see where we can insert those coping skills. And we practice them in session. Identify what are the corrective beliefs? How can I learn how to coach myself? Because I don't want them to be dependent on me.
When I went to my counselor, he would give me some things. Almost every time, hey, now that you've shared that, I think this would be good for you. Here's
Yeah.
what it is.
Yeah.
Here's some things to think about when you look over it. Here's some things to be careful about. You know, he would give me some guidance. Like I guide my patients too. Like I tell them, hey, and every patient's different, but here's a principle I tell a lot of patients, especially pain patients, is like, hey, you're going to experience some pain. Yeah. Irritation is normal. If it gets above a 5 or above, let's change things, but not stop things.
Yes.
Right? It may be the volume, which is the reps. It may be the resistance, which is the weight. Or it might be the range of motion. Right? Like, go to that point that is beneficial.
Yeah.
Right? That's what I tell a lot of patients.
Very similar.
Yeah.
Hey, we're just trying these skills out, especially if they've had a lot of trauma. This feels really scary. Like, let's go slow, right? Go at your pace. Maybe we're gonna experiment with, just because it's not like, oh my gosh, I failed at it. No, no, you learned something, and like, how can we keep practicing that skill? The first time you work to manage a trigger, like, I know for me, I didn't recognize it till after. I was like, oh. Yeah. But every time I worked to recognize it, then it started happening where I was recognizing it coming up. Oh, this is like the start of when I'm starting to get anxious and use the skills. And so constantly inviting my clients to learn how to do the work of self-management, being present, and then we'll often end a session like, okay, here's what I'd like you to focus on noticing this next week. So really putting it back on, here's the work and the responsibility. The more that you can work to notice those things, the faster you move that acceleration. Love also recommending books, because I think you have to have language to have insight.
You got to renew your mind. Right?
Have right thinking.
Scripturally, that's what we believe, right? Yeah.
Put pieces together. Yeah. Because sometimes we don't know what we don't know. Yeah. I was on a Zoom call last night, and they were talking about some of the challenges that people have relationally with overspeaking. And I know that often comes from growing up with emotionally immature parents as one of the impacts. It's not because people don't want to be relational, but we don't learn the art of the benefit of mutuality and how we do this. And I didn't know about those things until I read a book and I learned, someone put language to the impact. And so I think that's where reading, now it's not like, oh, I'm going to judge you because you didn't do your reading. Like, it's not required. It's an invitation. I can name tons of books that I've read when I was going through counseling. I don't know if you know Ed Welch. No.
Okay, yeah. Great books by him, but we are running out of time.
Yes.
And I want to respect your time. I didn't realize that we're already been talking for like 30 or 40 minutes.
Yeah.
Wow. Well, the last question I would have for you, just so I can respect your time, is like, is there any, like, how can someone work with you? Is there a special that you have to offer maybe on this podcast today? I don't know if you do cash or work with insurance, but is there an offer that maybe you could shoot to the people today?
Yeah. So we offer a free 20-minute consultation, so people can learn about our unique approach, the way that we work, see if it's a good fit for them, see if it lines up with their goals and what they're hoping to address.
The same thing.
So that's what we talk. I give space for them to ask questions, because I want them to be informed and make an informed choice. I also work with I don't take insurance, but I will work with them to send them a super bill.
I do the same thing.
And encourage them to talk to their insurance company, because it never hurts to ask. And then I've got an associate, so if my rate feels out of their budget, that's why I love having a team, because she's under amazing supervision, and they're going to get high quality counseling.
I have 2 great girls here, our therapists, that I have mentored and educated, and I'm always available,
I'm providing oversight and coaching. And so, we understand, like, people have different budgets, and I also offer sliding scale. And so that's, we try to make it work for people to have access to mental health.
I do the same. I work with people all the time. So
yeah,
that's awesome. Let's see what else. I think that's pretty much it. This was very enjoyable.
Yes, thank you so much for the opportunity, Larry.
Thank you. So Yeah, if you have any questions, shoot us a message. I'm going to be posting this on YouTube and Instagram. There are going to be some shorts out there. And so if you see one of the shorts or one of the Instagram posts, send me a DM. I can connect you with Elizabeth. And so, yeah, reach out to us.